Hi everyone, I'm Dr. Rita Roy, CEO of the National Spine Health Foundation. We're here to improve spinal health for everyone. It's an honor for me to bring this Spine Talks panel to you. Spine Talks provides unparalleled access to world-class experts like the doctors who are joining us today. Our panel will be moderated by Dr. Tom Schuler, Chairman of the Medical and Scientific Board. Tom will also introduce the panelists. Dr. Schuler?
Well, thank you, Rita. It's truly exciting to be here and to be with so many esteemed physicians. The National Spine Health Foundation works to bring you the information so you can help make the right decision, so that you can understand the best options for your care. And today, we're blessed to have 4 incredible surgeons join me who are part of the Medical and Scientific Board.
I think that the big thing is to be informed. There is a lot of data and there's a lot of information out there, but I think your doctor, especially if he or she is well informed, can help guide you in that process. You can turn to the Scoliosis Research Society webpage in terms of baseline information, but then ask again your doctor what they believe the best care is, what their patient outcomes are, what they would do in this situation, what they would do for their loved one, because I think that then provides perspective then in terms of how this impacts you as a patient.
Excellent. Dr. Shaffrey?
Yeah, I think that the one thing, particularly for the larger the surgery that's proposed, the better you should feel about the relationship with the people that are treating you, because it's a long-term relationship. So for many of the studies we're doing that I'm involved in, we're following people out to 10 years. So we like to see them back. We like to monitor what's happening. And hopefully that the time that you've spent before surgery in the relationship has given you a good idea of what the course is going to be afterwards. And a lot of these surgeries, you have little bumps in the road. There may be, while you're in the hospital, there could be some small issue comes up, or 3 months after surgery, an issue can come up. And the fact is that there should be comfort to realize that most people at 2, 3, 4, 5 years down the road are doing very well. And we had a study that showed that 94% of the people who had a major deformity surgery would have it again, all things considered, despite the bumps in the road. One of the things that we had some question about, and how research has helped us, a lot of people knew that people initially after these big surgeries that they were very successful. But several of us were involved in something called the Adult Symptomatic Scoliosis Study, which was funded by the NIH. And what's happening, we've now followed patients who have had major deformity surgeries. We're now at 7 years, and the results at 7 years are as good as what they were at 2 years. And almost nobody expected it to be that good and that durable. So what's happening is, I think it's important to have a good relationship with the person that is going to be operating on you. You want to feel very comfortable, and you want to have somebody that's going to guide you through some ups and downs over the first few months after surgery, and hopefully is going to be there as a resource for you in the future. And sometimes, for example, I might suggest a very small operation to take care of a little small problem that's part of a bigger problem. And that's something that we have that decision that we're going to do something. I say it's kind of hitting a single versus hitting a home run. Sometimes you can hit that single and the risks are very small, and you're back, out living your life, a couple of weeks after surgery. And so that relationship allows you to do that, and realizing that if something more serious comes along, which it might, that you have that relationship established to do what needs to follow on next down the road.
Dr. Gupta?
Yeah, so I think the first thing I want to say is I want to be encouraging. Don't be discouraged just because you have a big spine problem. Knowledge is power. There's a lot of information on the web. There's a lot of experts in the field. It's globally accepted now, and there's a whole set of global experts. So seek experts. Don't be discouraged. Ask questions. And if you're not satisfied, ask for more experts. Don't just settle on one bad story or another bad story or one good story. These anecdotal things can really be discouraging. Do not be discouraged. Keep asking questions. And that happens quite frequently. Patients get discouraged locally They don't seek the experts beyond local, what's available. So there's a lot of experts, there's a lot of great people in this field. Look towards major medical centers that have some of these experts that can handle some of these big problems usually. And so seek that out and seek help and ask a lot of questions, be inquisitive, and then I'm sure you'll end up in the right place.
Dr. Bervin?
Well, I'll build on that. I'll share on Manisha's message of encouragement. Spinal disorders can be discouraging, and those who are affected by symptomatic spinal disorders have got significant disability associated with that. And to that end, rejoice in the fact that we're at, and we're really beyond now, an inflection point in medicine where we're now able to take together data, information, knowledge, and provide better care than we've ever been able to in the past. I also think that the management of spinal disorders remains with significant variability. So between providers, between regions, and to that end, I think it's important to recognize that there's a broad spectrum of providers, from non-operative specialists, physiatrists, pain management doctors, to operative specialists. And I think engaging people along that spectrum is worthwhile, especially if you're not comfortable with whichever decision might have been recommended. I think engaging others to get other opinions can be very useful.
Treating spinal deformity is probably the most complex area in spinal health care. And so it's not something to be taken lightly. So if you are having spinal surgery for a major deformity, make sure the person doing it is an expert in that field, that they're working in the major societies, being involved in data collection, and that they're current in the best techniques. And I think that that's the important thing. And all these gentlemen are such giants in the field. So I'd like to thank you and really appreciate you guys taking the time from your busy schedule at this meeting to help educate the public. Dr. Roy?
Yes, thank you. I'd like to echo that thanks. And please visit spinehealth.org to learn more information and get the tools and information you need to talk to your doctor about the best treatment choice for you. There is hope. You can get back to your life.